what that does a little later. Okay, so there's your stylopharyngeus. You should have found it yesterday. Coming from the styloid process laterally, hitting into the pharyngeoconstrictors, and lying right on top of it is your glossopharyngeal nerve. Okay, there's a big space between this little middle constrictor up here, okay, and the inferior constrictor. Way on the side, there's a huge gap, okay. In that area, coming out of that gap there between the middle and the lower, is a big branch of the vagus nerve, okay, the superior laryngeal nerve, which splits and gives rise to an internal laryngeal nerve, which goes into the larynx and supplies innervation to all this area up here, and then an external laryngeal nerve, which goes down and innervates these two little muscles, or this one little muscle, the cricothyroid muscle, one on each side. Also coming down into this same hole, as you perhaps recall, is the superior laryngeal artery. Okay. Going through this membrane, connecting the thyroid and the hyoid, the thyrohyoid membrane. So you have your internal laryngeal nerve and your superior laryngeal artery both going in there. Also, down here below, right, is the recurrent laryngeal. It has to get into the larynx. It slides up from alongside of the trachea, goes inside the inferior constrictor to go up and innervate most of the muscles of the larynx. And then there's a little inferior laryngeal artery which basically travels with the nerve to supply blood supply to the larynx down there. We'll go over a lot of this when we do the larynx a little bit later, but this is some of the blood supply and innervation coming from other parts. Okay, what happens when we swallow? We have a pharynx for lots of reasons. One reason, obviously, is to keep food from going out the back of our neck. But the big thing that these constrictors do is to change the shape of the pharynx in order to, between the constrictors and the tongue, they can change the shape of the pharynx up here and push the food down into the esophagus. Okay, so this is what happens. But when you eat normally, presumably, the food goes into your mouth, just like that cheeseburger I showed earlier. The tongue pushes it up to the back of the throat, back of the oral cavity, actually, in the oropharynx here. Then the back of the tongue and the upper part of the pharynx constricts and pushes it down through the pharynx into the esophagus. Okay? The first part actually requires work. You have to sort of force the food back in there, and then reflexes take it all the way down. And I think that should be the end of it. Okay, so that was fairly long and not actually related to what we're doing today in general, but you've got to know it anyway, because I'm not giving a lecture on Friday. Okay, so when you go into dissection, most of you, I hope all of you, after you disarticulate the head, you looked at the back of the pharynx, found your glossopharyngeal, found your vagus, probably found your spinal accessory, and identified your constrictors. If you didn't, continue with that, identify the various constrictors, see what you can do in finding the gaps. And then we're going to bisect the head. So we're going to saw it in half. Again, you might want to get help with your instructors, because there are ways of doing it well, and there are other ways. Once you've done that, you can look at the pharynx. Before you bisect the head, slit the pharynx down in the back in the midline. Don't try to use a saw to saw into the pharynx. So with a sharp scalpel, cut the pharynx in from the back. Take a look at the nasopharynx, the oropharynx, and laryngopharynx, because once you pull the constrictors aside, you can see into those openings. Okay, know roughly what's where. Then, once you saw the head, you can look into the side walls of the pharynx and into the walls of the nasal cavity and the oral cavity. Okay, this is what you'll do. We won't mess with most of the inside of the nasal cavity until Friday, but that's what that section is. Okay. Part of what you're doing today was in the movie that we saw earlier, but because I'm not going to be lecturing on Friday, I want to show you the next movie, which again has today's dissection and Friday's dissection. I hope we don't get run out of here.
Hey, Dr. Gold. Hello, Dr. Cole. Today we're doing the pharynx, nose, and nasal cavity. Great. See you tonight. The first thing you're going to do in lab today is bisect the head. To do that, you're going to cut through the soft tissue of the face, and if there's any soft tissue left on the back of the skull, you'll cut through that too. And then use a saw to saw down the midline. Once you have all the bone cut, you're going to need to use a scalpel to cut through the tongue and through the pharyngeal constrictor muscles on the back. So that gives you this nice textbook view of the inside of the skull. And you're going to start identifying features in the nasal cavity and the pharynx. To start, the nasopharynx starts from the internal choanae to the uvula here. The oropharynx is the space inferior to the uvula all the way to the epiglottis here. And then to get to the laryngopharynx, I'm just going to
back to
this forward a little bit. There. So the space inferior to the epiglottis and all the way down to the cricoid cartilage is the laryngopharynx. Within this space, you just open up the esophagus a little bit. Back here is the piriform recess. Space back here. And then you can set the head back on the vertebral column and sort of leave it open like this. You're going to want to find your pharyngotympanic tube, which drains the middle ear here. And then you're going to move on to the nasal septum. Now the nasal septum is not usually directly on the midline, so it will end up on one half or the other. In our case, it was on the left half, so your view is going to be a little bit upside down right now. But on this nasal septum, you're going to peel away the mucosa and look for the nasopalatine nerve, which is there. And then you're going to look at the nasal cavity and identify the superior, middle, and inferior nasal conchae and their corresponding meatuses. Inferior, middle, and superior. Once you've done that, you're going to cut away the inferior nasal concha, side, and look for the opening to the nasal lacrimal duct, which is up here, tucked underneath where the concha would. You're then going to cut away the middle nasal concha and look for the semilunar hiatus, which is the opening for the frontal and maxillary sinuses and the anterior ethmoidal cells. You'll look for the ethmoidal bulla, which is this pouch in here with the opening. And then the last thing you're going to do today is look at the sphenoid sinus, which is just here, and some of its features. And you'll identify some features of the maxillary sinus as well. And that's it for today's lab.
Okay. So that's mostly, well, that's a little bit of today's section and most of Friday's section. again, when you go in, again, just unzip the bags all the way and check to see if there's mold in them or whatever. Because we don't want them all to be green.